All right, you guys, we are back with Dr. Emily Kraus. We are so excited to have her back. If you guys missed the first episode with her, it was episode 34. I think it came out, goodness, in like mid 2022. So go back and check that. Lots of knowledge bombs in there for sure. So thank you so much, Emily, for joining us.
I'm so glad to be back. I feel like it's an honor to do a repeat podcast with you, and just love the work that you're doing. And
thank you.
Yeah, happy to be here.
We love the work you are doing. That's why you're back. We're so stoked to have you. And as our listeners know, before they get to know too much about you, assuming they maybe didn't listen to the first episode, we're going to go ahead and do Two Truths and a Lie. And we were trying, before we hit record for our listeners, we don't remember if we did Two Truths and a Lie with Emily on episode 34. So this might be new news for everybody. So go ahead and break them down for us.
And if we did do them and I had the same, this will be a fun test for you to see how much you remember from the first time.
Yes, from a year ago. We'll see how much my brain holds on to.
Yeah. Okay, here we go. Number 1, I played the flute for 10 years. Number 2, my first healthcare job was as a certified nursing assistant. And number 3, I won a local spelling bee in middle school.
Okay. I mean, I feel like you won a spelling bee in middle school. I feel like you did that. I'm kind of wondering if the certified nursing assistant wasn't part of your journey. And I'm trying to remember back to your intro that you shared with us back then. I feel like that might be the lie. But what do you think, Amanda?
I was thinking the same thing, because I feel like a lot of very intelligent people play music.
Oh yes, that too.
Spelling bees as a kid. So yeah, maybe
it's talented,
slightly different. Yeah.
So I'm okay. Go with Don't tell us the answer, Emily. We'll reveal it for the listeners at the end if that was part of the journey or not.
Okay.
And what was the winning spelling bee word? If that was true, I would love to know if you remember. So let's see. It's been a minute since we chatted with you last. Mid 2022, I'm thinking, was when we had our last episode. Update me on us and our listeners on what's been going on. Goodness, with all things research on the female athlete and FASTR and what's been going on.
Yeah, so I feel like we are in this wrap-up phase of a number of different research projects, which is really exciting. It's an indication that, one, we've collected the data, and we've been able to successfully get through a study without having too many roadblocks and challenges, which I feel like that's inevitable with all of research. And it's also in this fun data analysis and also sharing with the world phase. So we had a streak of conferences last spring and summer where we got to present a lot of our research. And the one of the research studies that I think we had talked about before was our Healthy Runner project, which is where a lot of my research and experience doing research started when I was in residency. And this was the PIs, or the main research leads, or principal investigators, were Dr. Michael Fredrickson and Dr. Aurelien Nativ. Dr. Fred is what we call him. He's at Stanford. Dr. Nativ's down at UCLA. And this Healthy Runner project was a 7-year, 7 years of kind of historical pilot and intervention research years that we've collected data and retrospectively looked at charts through, which is pretty incredible to be able to capture that. And we used 2 different sites, UCLA and Stanford, and the collegiate D1 runners at those 2 sites.
Nice.
And we looked at different an intervention to reduce bone stress injuries in those runners. And the intervention was a nutrition educational program, primarily run through the sports dietitians at those respective institutions.
Awesome.
And it's been really interesting to see some of the takeaways, which, if you would like, I can share some of those.
Absolutely.
Those teasers.
Yes.
Awesome. We've published two manuscripts, which I can give you the details on. One was in the British Medical Journal, Open Sport and Exercise Medicine.
Okay.
It's an open access journal, which is great.
Yeah.
And then the other one is in the Clinical Journal of Sports Medicine.
Okay.
And so the key takeaways that we found was, let's see, I'm using my notes because the last thing I want to do is misquote my own research.
And that's all good.
So a little bit more background. So we had total number of runners as far as we collected information on bone stress injury rates, both historically during this pilot phase where we looked at just trying to launch this nutrition intervention in those groups, and then the intervention phase, which was from 2016 to 2020.
Wow.
And we found that through that intervention phase and throughout that process, we found a reduction in bone stress injury rates. And specifically looking at different types of bone stress injuries, and just to loop our runner or our audience into what a bone stress injury is. It's an overuse injury of the bone. It can be a stress reaction, or it can be a stress fracture. I think sometimes stress reaction, stress fracture is more commonly used, maybe more in the clinical setting, or maybe they've heard that, or maybe they've been diagnosed with that themselves. And we found a drop in rates at both institutions, and specifically with the trabecular-rich bone stress injuries. So those of like the femoral neck and of the pelvis and some of those higher risk sites. And then specifically at one institution, we saw a drop in all bone stress injury rates.
Wow.
And that was through that nutrition intervention.
Amazing.
So I know it's hard to kind of get deep into a lot of the nuances and details of the study in just this short amount of time, but some of the main findings and takeaways that we had was it's challenging based on just changes in coaching and changes in culture to try and implement this type of a program. And so there can be some of those even roadblocks within even study implementation. And we realized that culture and team culture is really important. And so having your team captain and having part of the teammates really buy in to both the nutrition intervention and some of those practices is really key to get the long-term effects and some of that lasting change and some of the behavioral change. And you can see that a little bit even just within the write-up and some of the trends from the two different institutions, that there are some inconsistencies between those institutions, because as much as we'd like to have this like perfect implementation and perfect team dynamics at all times, that's not always the case.
Right.
And that's just the reality of doing research, and also just working in those settings. So that was one of our studies. I'll pause and just see if you have any questions about that specifically.
Couple questions that come to mind. So you said stress reaction and stress fracture. Are those the same, or are they different?
Good question. So stress reaction is a type or an evolution of a bone stress injury.
Okay.
If we had a bone stress injury as kind of that main term, stress reaction is the more milder form. Gotcha. And most injuries of the bone, or overused injuries of the bone, which the most common location is the tibia or the shin bone, are qualified or categorized as a stress reaction. So it's an overuse injury of the bone that has not led to an actual fracture line of the bone. So if you looked at it on an X-ray, you wouldn't see the little break in the bone.
How does one know that they have a stress reaction? Like what are people like yourself like looking for in that? Is it just pain, or is it inflammation, or? Yeah.
So it usually presents as some level of pain. Sometimes it's pain with activity, and usually that's in a runner. So it's just pain with running, and it often can resolve once they stop running. And sometimes it's a little bit more vague. For example, femoral neck bone stress injuries or stress reactions. Those are of the hip, and that's part of the hip bone and hip joint. And that could be this vague hip pain. And I don't want the listeners to be like, I have hip pain. Oh my gosh, I have a stress reaction. But it's usually like there's a lot of other pieces that you have to think about. But it's usually like gradual onset discomfort and pain in a location. And then when they come in to see me, I will often start by getting an X-ray. And if it's a stress reaction, as I mentioned, we're not going to see anything on the X-ray. And so my suspicion, if it's high enough, I'll get an MRI. And that's where we start to see more of the details of the bone. And we can see the more subtle changes, the inflammation of the bone, which we call edema. So there's a change in the color of that part of the bone when we see it on an MRI that suggests or that indicates bone stress injury or stress reaction.
Wow. Interesting. And so I would imagine too, with something that's a stress reaction, it doesn't feel better after a couple rest days, right?
Right. So usually what I'd recommend to an athlete, if they are concerned that they have a bone stress injury, is give it a day or two, maybe three. And so completely maybe non-impact activity. If they're working with a coach, maybe they can get some cross training, some swimming or other activities to just kind of maintain some aerobic, or just take a few days completely off.
Yeah.
And then maybe go out for a test run that next day, shorter distance, like don't go for a 13-mile run on that next day to test it out.
Right.
And then if that pain returns, then I would say potentially go to your sports medicine provider and see if there's some additional workup that needs to happen.
Okay. Awesome. That's super helpful. Okay. And then my one other question, which you maybe were getting to, was, of course, you mentioned these nutrition interventions. Do you have details on maybe like briefly what those nutrition interventions were, or was it very much individual, or like you were saying, having the team captain get on board and like encourage certain behaviors around nutrition? What was that like?
Yes, I have some details.
Okay.
I do want to give a shout out to Michelle Barrick, who
yes.
helped write out the nutrition education plan for
Amazing.
each site. But what we started with was an individual athlete assessment. And that was a pretty lengthy survey that helped determine typical nutrition and eating patterns. It's really difficult to get a super accurate assessment, as you know, from just a survey or kind of the self-report. You kind of need to build up that relationship with the individual, but it's a good starting point. And then we got a lot of other medical history from the pre-participation physical, so the physical at the start of the season, and then each respective sports dietitian from each site provided a nutrition education presentation at the beginning of the season. And then that focused on the importance of adequate fueling, timing, so kind of both snacks and post training. And then on an annual, they also did some one-on-one or smaller group based on need.
That's
so
awesome.
It was a kind of a combination of both just group basic covering the basics, which I think even these athletes who are at the collegiate level, you can't assume that they know all of the specifics about fueling. I think they've gotten to where they are through fueling, but sometimes some of those important areas of energy imbalance maybe haven't really gotten the deep dive yet.
Right.
And then there was more individualized based on need.
That's great. And out of curiosity, was there any with the survey? Do you know if they were asking anything about menstrual cycle health or regularity?
So we got information from the pre-participation physical, which was all self-report. And a lot of the work that we are seeing now is that self-report is helpful, but we're not getting some of the important details or maybe the accuracy of is that menstrual cycle or are those periods truly regular? Like, are they happening monthly? Are there more subtle changes that we're not able to detect? Maybe they're having a bleed, but there is some level of hormonal suppression if we had more information through additional testing, for example, like lab work or urine testing.
Okay. Yeah. Very interesting. Very fascinating. So, so this was the Healthy Runner Project kind of takeaways you're saying, right?
Yeah.
Were there other updates from that, or are there other stuff you want to share, or next projects you got going on?
I mean, I could probably spend a whole hour with you on the Healthy Runner Project. It's so, 7 years.
Yeah. 7 years is impressive.
Yeah. The other part of that study was we did expand it to other universities for a year, and that data is still getting analyzed and still getting reported out. But it was more of an implementation into these other universities and some assessments more on athletes' readiness to change and readiness to adopt these behavioral changes. And I think that's an important consideration that maybe sometimes we don't have time to really go deeply into when we work with athletes, especially when we're maybe doing some of these implementation studies. If they're not ready to make some of these behavioral changes, we've got to start at a different spot. And that nutrition intervention is probably either going to go over their head, or they're very knowledgeable
Yeah.
athletes. And so they may just be like, hey, I like my program. I like what I'm doing. It's working
Yeah.
for me. They may not be experiencing a lot of injuries at this point. And so
Mhm.
they are like,
Right.
this doesn't like, I don't feel like it relates to me.
Yeah, that
So
makes sense.
that was another part of the study, but I have multiple other studies that I can share with you if
Yes,
you
please.
want to go there.
What excited one, like which ones excite you the most that you want to talk about?
Yeah. I'll talk about it's hard because I get excited about all of these,
Yeah.
which is, I guess, why I'm doing what I'm doing. There's maybe
exactly.
some validation there as
Yeah.
far as career choice.
Yes.
But our FASTR video studies
Mm.
wrapped up this past, I think about a year ago. It
Okay.
officially wrapped up. And this was a project that was led by Dr. Megan Roach
Mhm.
and our FASTR research team. Abby McIntyre is our research coordinator, so I want to give her a big shout out.
Nice.
And we aim to evaluate the effect of a 5-part video education series, looking at, and the topics that we covered were the female athlete triad, which I can talk about, relative energy deficiency in sport, which I can also talk about. Both are related to fueling mismatches and potentially under-fueling, overtraining, and the effects of that. And then we also looked at other areas. We discussed other areas like bone health, menstrual cycle, and mental health topics. And these videos are all available on our FASTR website, so people can check them out. And we compared that to just online education through different handouts and different websites and resources that were also kind of high credibility. And we also wanted to evaluate the feasibility of implementing this type of study in high school runners, female high school runners. And then we wanted to gauge their interest, their engagement, and what they wanted to learn more about. And we found that, and we looked at, let's see, I'm looking at my notes here to make sure I get my numbers. 45 runners were in the video group, and then 39 runners were in the control group. And we tested their knowledge as well in these two groups. And we found that both the videos and the handouts, or those online tools, or the online education, improved knowledge.
Great.
From study start to post intervention.
Yay.
However, we found that the videos led to increased interest, increased new information, and just a desire to actually change behavior. And what we didn't study was, did this actually lead to behavioral change? And that's kind of a follow-up study or something we're talking about doing. But for us, it's really interesting to know that the videos were helpful and informative, but also led to some of this interest. And another part of the video that was really, really special was, it wasn't just an education, a lecture, or a PowerPoint lecture. We included the athlete stories, and we had these power athletes providing their experiences dealing with some of the topics, from bone health issues to talking about the importance of mental health, to talking about their menstrual cycle and those experiences. And I think that this combination of blending inspiration with education is more impactful and powerful than just education on its own.
100%. And I think I caught some of those too. Was Kate Courtney in one of those?
Yep.
Yeah, I saw hers. And then too, with the educational material, you also have PDF downloadable things as well, right? Yeah. Those are great, you guys. For the listeners, I checked those out. Super, like, I think they're fantastic resources to utilize. I think those are great. You guys are awesome.
That makes me so happy that you, I feel like, with your knowledge base, have been able to find it useful
I found
to share
it
with your athletes and share with your clients.
Yeah, definitely. So with kind of that whole program that you've built, is the goal for that it's a free resource open to anyone? So the hopes is that it can be used for, like you're saying, maybe high school teams and coaches can share that with their girls and boys and stuff like that. Yeah. Awesome.
Yeah. I mean, our goal is we want to disseminate this information far and wide. And I think that we've found that coaches love this information because they're trying to find somewhere to turn. They're trying to get more of a knowledge base, but it's hard. A lot of these coaches, they're juggling a lot. they have a lot of athletes that they're coaching, and they want to be able to provide them the resources, but having something that they can hand to them, and then where those athletes can seek out more information, or even go for help or resources, or just know where to go if they're struggling with some of these issues, is incredibly important and impactful.
Yeah. Definitely. Yeah. And I think the delivery too of I remember when I was looking at the PDF, so there's a lot of like great, easy to interpret visual content. And I think, with the younger age group, that's really important to like get that across. But I think you made a fantastic point of like pairing, not just like your mom telling you to do this thing, and then the kids are like, whatever, not going to do it. But like having somebody they look up to from an athlete, like a professional athlete perspective, is, I think, such a great way, like you're saying, to tie those two worlds together. And video content, the teens love the video content. So that's really smart. Yeah,
that was our hope. And I think that even though we initially targeted the high school athletes with this initial study, a lot of this information can be taken to the collegiate level, even potentially post collegiate level.
Yeah.
And we are implementing something slightly different at the collegiate level through what we call WATS, which are Women's Athletics Team Talks.
Oh, cool.
And we're really excited about these. We're learning as we go. This was something that's evolved from just an idea of trying to engage collegiate athletes and educate them, to actually going to to the team, giving a team talk based on a pre-talk survey that those athletes fill out, ranking what they want to know about. So it's a very custom talk, but it's not, again, not a lecture. I give a lot of lectures. And so I know I feel like I try to engage people and keep it pretty exciting, but it's way more entertaining, and I think helpful. And I think that it's a better experience if we can have a dialogue. Yeah. And there can be, for example, this last time I did a menstrual cycle team talk for the women's basketball team, and I was on the whiteboard drawing out the phases of the menstrual cycle with different colors, and it was a very interactive experience for those athletes, and they had a lot of positive takeaways to the point where we're going back to them and covering some other topics, which is what we wanted. We want them hungry for this information and empowered with this information. They can learn about their menstrual cycle and about nutrition and fueling, and feel comfortable talking about all these things. Yeah, that's great. And the more you engage with the audience, I mean, the more they're paying attention too, right? And that's fantastic. So with kind of the FASTR video stuff, we will link all of that in the show notes too for the listeners, so they can check videos out and the downloads and all of that stuff. And then let's see, anything else coming up with FASTR this year, like down the pipeline? Or so we've got a couple of studies that are in the works, and so that's like, we're kind of like in the thick of the hustle right now, as far as wrapping up writing. I just got off of a meeting. I'm writing up another manuscript for another study, and so that once that comes out, we'll share it. Hopefully we'll get our first journal, so we don't have to go through that process multiple times. Right. But we've been there. Fingers crossed. But we have a pilot study that I think we're still recruiting. We're still needing a few more athletes for, if in the Bay Area, if we have any listeners in the Bay Area that fit into this. I think it's 18 to 30 age range. This is a runner specific study. But that's called, it's a multi-omic study, and we're actually looking at some of the molecular profiling of relative energy deficiency in sport. Oh, interesting. Or REDS. And this is mainly to look at some of the other potential earlier predictors and kind of that deeper molecular level of changes that could be experienced by athletes with higher REDS risk, and just to kind of get people on the same page with REDS, which a new consensus statement just came out. So we'll have to refresh all of our infographics and all of those tables and definitions a little bit more. But it's all the potential health and performance consequences from low energy availability. And low energy availability is from a potential of overtraining or underfueling or some degree of that. And and how that over a period of time can affect the body.
Yeah.
So the goal is to kind of study that in a deeper, more molecular level, which is, I have to work with a lot of my collaborators because I'm not a molecular scientist. And
Yeah.
Morgan Smith, Aubrey Roberts, Mike Snyder, all working at Stanford and part of the research team that have been really spearheading that research.
And when you say molecular, what kind of like markers are you guys looking at? Is this all lab, like blood draw type of molecular? Okay.
Yep. So actually blood and urine. We call it's part of the world of omics.
Okay.
And I feel like I need to get a whiteboard and get probably Morgan or Mike Snyder in here to explain exactly all the different types of omics.
Wow.
Lipidomics, metabolomics, and it's really exciting research, but it's at this level of analysis and data that requires expertise beyond my level of training, which is, it's humbling, but it's also incredibly exciting to be able to collaborate within Stanford, and then within how FASTR was developed was within the Tsai Human Performance Alliance. And that's just led to all these incredible collaborations within Stanford and beyond.
Awesome. So with something like that, kind of is the hopes to maybe like more frequent lab work and monitoring to see when things are potentially like suppressing or becoming elevated that could be these potential markers, pre-markers to LEA or REDS?
Yeah, I think right now one of our challenges from a clinical standpoint is we're catching REDS at a later stage when there's already the regular period present. There's maybe even the injury that's present. There are already effects on bone health and decreases in bone mineral density. And if we had earlier markers or biomarkers that we could catch that low energy availability in, they use this 4-color light, street light now, with green, yellow, orange, red being most severe. If we could catch athletes in that yellow stage where maybe they don't even notice, maybe they're not even experiencing performance decline yet, but they're having subtle hormonal imbalances that could be picked up on some of these, a lab assessment or something that's really simple and easy to use, that would be a game changer. And it could keep the athlete in the game, in the sport longer, avoid these cycles and avoid some of the expense of losing time in sport, excessive money and stress, and just the pains of being on maybe an injured or underperforming list for a period of time.
Yeah. And from like the nutrition side, it makes me think like having lab work done versus trying to get, like a minimum of a 24-hour nutrition recall, but then comparing that to their energy output on a single given day. Like it just takes so much time. And like, how accurate is that? That's
right.
tough.
And it's not like athletes are unintentionally like underreporting. Sometimes that is the case. But I think it's just so hard to think about like all of their snacks and how stress plays a role in all of this, and how certain stressors just can have a greater impact on the metabolism. And I think like my personal example is like getting married and being in Switzerland and all the travel that you're doing.
Oh goodness. Yeah.
I felt like the stress, I was like, oh my gosh, I got to stay on top of my fueling, because I'm going to slip into this just because I'm not factoring in all the like the stress and my like impaired sleep and all these other things. And I thought about all of my subjects and patients and athletes that I'm working with, and how to find ways to better inform them, but also better practices and better assessments.
Kind of on that note, we may have talked about this in our last episode, but how long or how many days of underfueling or nutrition mismatch does it take before someone potentially is starting to experience some of these LEA symptoms?
Yeah. So some of the early research that's been done is by Dr. Ann Lux, and some of her work was looking at different hormonal biomarkers.
Okay.
And athletes like in those early stages of low energy availability, like first 3 to 5 days of low energy availability, would start to have suppression of like IGF-1, so like like insulin growth factor hormone, and start to suppress some of their thyroid tests. Even like bone turnover markers start to get altered during those first 3 to 5 days.
Wow.
I think if I remember correctly, the estrogen and some of the other sex hormones took a little bit longer to kind of show and present themselves.
Wow.
But yeah, the early markers started within 3 to 5 days. So I think that that's important to think about. Is it doesn't take long. I think the good news is that can recover quickly.
Yeah.
When we're talking about weeks to months, that's where we get a little bit more concerned about some of the long term. And I have athletes that have had missed periods for 6 to 12 months and or no periods for 6 to 12 months. And it can take a long time for that to get back. And I think athletes get really frustrated and impatient, and they're like, what's going on? Why? I'm doing everything right. I'm fueling, I'm listening to my dietitian. I'm working at I'm training at a lower volume, and they start to have doubts in the process. And a lot of times, and maybe I'd be curious your experience on this too, as far as like just having to be patient through those first few months to 6 months.
Yeah. Yeah. I mean, that's a great point. And again, kind of like to question back to you too, out of curiosity, is like, is that something where, cause I've absolutely run into that too, where we'll have a client and we are getting them to do these things. Maybe it's even slightly reducing activity to so they can tolerate the necessary nutrition coming in, and hit those targets without having to like increase food even more. And we're seeing things improve from a lab work perspective, but still no signs of a cycle. Is that something where is the lab work a tool to like help give them that validity of like, hey, these things are improving, and like, yet we're still not seeing signs of a cycle, but we want them to continue to improve more. Like, how do you go about that?
Yeah. I'll track certain biomarkers.
Yeah.
Oftentimes thyroid tests are good. They can always they fluctuate. And so I'm always curious about like, why is this one up and this one down? And I'm trying to always think about some of the limitations of all of these biomarkers. So I'd say that's pretty helpful for me. I'll track sex hormones, but maybe a little less frequently. But you start to see them respond and kind of level out, and then they start to experience some of the return. And sometimes they experience some of those sex hormones effects, like changes in mood and mood fluctuations, and like increased sweating and like facial acne and all these maybe unwanted consequences or unwanted effects. But for me, I'm like, this is awesome. This is a sign your body's starting to come back, and things are starting to recalibrate. And I feel like it's so variable from athlete to athlete that we have to just kind of take each one individually and try not to play that comparison game too much. I feel like that just usually is less helpful than productive.
If you have an individual where you have sex hormone and thyroid lab markers from when they were having a cycle, and then they go through a period where they lose their cycle, are those numbers that you're targeting to get back to where we would expect to see a cycle return potentially?
Yes. I'd say that's helpful. I'd say for those lab values, even getting back within like a normal range, just based on what the ranges are also really helpful. And, I don't think we want to get too deep into like kind of weight tracking and looking at weight and body comp. I think that can be helpful if like used in the right context, and potentially even like having that as a physician or a dietitian to just see where those numbers are going, as opposed to sharing that information. Because I think with some athletes, it could be triggering and they don't want to see those changes during the process. But I think athletes are like, they can adapt and their body will find that set point. And so I try not to have them maybe panic or get too concerned of their body changes during that process. Because things will kind of regulate out once their cycle is back in working order.
Yes. I think that's a great point you bring, because I have seen clients where their goal is to improve these things, right? And to get their cycle back. And we're seeing the lab markers show that, but then they realize, oh my goodness, my pants are so much tighter, or like, I feel like I have more, body fat on my core. And then they totally can like spiral backwards.
Yeah.
And that's hard.
And it is hard. And it's like, I think going back to that, either comparing to another athlete or even just comparing to a prior self. I mean, there's just different needs and demands based on different stages of life.
Yeah.
And I think that these athletes maybe are comparing themselves to a state where maybe they weren't feeling properly, but they were feeling really good. And I think that's the hard part, is they were feeling good, but they were on the verge of not feeling good and at a very high injury risk during that time. And they probably, like, the underline and underneath the hood things that were happening in their body during that time have consequences. And I think that there's just like this emphasis that we have, and we push that, like, even with our videos, talking about the long game and thinking about the long game.
Yes.
And it's not just about the next season, it's thinking about the next season plus 5 seasons, 5-10 years from now, how your body's going to respond to the habits that you're doing right now.
Yeah, I think that's great. And also, like, psychologists and therapists are great to pair with this, right?
Yeah, thank you. I feel like working, and I feel like I get on a soapbox about the importance of mental health and working with a mental health specialist. And some of my athletes are on board, and some of my athletes are still really resistant. And I think that there is just like, that's such an important component, is addressing some of those blockers that athlete may have. And whether it's a body image blocker, whether it's just a stigma around work, like seeking help, that these athletes, they're so driven and motivated. They're like, I don't need someone else to help. Like, I can manage this myself. And being able to surrender a little bit. And I think that's a turning point. And I think that, like, at that point of that athlete surrendering and giving up a little bit of that control can be so impactful and so powerful for them, both in like performance and just personal development and growth. And that's where I think that the greatest gains can be made oftentimes.
Absolutely. Yeah. And so if we have time, I know we want to get you out of here before the end of the hour, but you just released a recent manuscript, and it's on mental health, talking about mood and all of that stuff. Do you have a couple minutes to give us a brief on that? And then we'll link it for the listeners in the show notes so they can dive into it more as well.
Yes. This was a study that, I sent it to you. Great. That it's called Mental Health Matters. And we chose that for a reason. And it was our lead author was Emily Miller Olson.
Okay.
She was a co-resident with me, and then a sports medicine fellow at Stanford. And then Dr. Roche is on that, and a few other of our collaborators and researchers. We actually launched this during the pandemic. And it was a survey-based study, which a lot of researchers pivoted to survey-based research during the pandemic, just to get creative and find other ways to do some important research. And we basically wanted to better understand whether there was an association or there were some actual mental health links or ties to the female athlete triad, which just to get the team up to speed, or the listeners up to speed, female athlete triad, 3 interrelated components of low energy availability. And this could be, again, without a true eating disorder, could be unintentional or inadvertent underfueling, leading to hormonal suppression, which can cause irregular or missed periods. So that's number 2, is the period dysfunction or irregularity. And then the third component is impaired bone health. So that's low bone mineral density or bone stress injury. And we found when we had distributed this survey out into the world, and got looking at my notes here again to make sure, and we looked at in this particular manuscript, male and female high school, collegiate, and post-collegiate athletes. We actually captured a larger group, but it was a bit more inconsistent as far as the numbers in those other populations and other sports.
Mhm.
So we specifically looked at this specific subset of a population,
Okay.
and we were able to capture 780 women were
Wow.
did the survey in that group.
That's great.
And let's see, we had 67% of women and 41% of men reporting at least mild anxiety symptoms, interestingly. And 54% of women and 38% of men reporting at least mild depression symptoms.
Wow.
And we found a relationship between the triad and symptoms of depression and anxiety in women. And I think a lot of that stemmed from that low energy availability piece, because we did another sub-analysis and looked at depression and anxiety and low energy availability specifically,
Mhm.
and history of either disordered eating or eating disorder. And I think that making sure that the mental health is discussed and resources are provided to that athlete is such an essential part of the care and the management and education to
Awesome.
help prevent some of the consequences.
Yeah, that's fantastic. Definitely just that further validates that additional resource and that team too that needs to be built for those sports teams and individuals as well, the healthcare team. Well, this has been amazing. I want to be so mindful of your time because you are a busy lady and you got to produce some fantastic resources for us, regular folk out here absorbing your information. So I'll quickly go back to your 2 truths and a lie. You said, played the flute for 10 years. First healthcare job was a certified nursing assistant, and that you won a local spelling bee in your middle school. Amanda and I thought the nursing assistant was the lie. Which one was it?
You don't think I could be a nursing assistant?
Well, I know.
Or you didn't think it was part of my healthcare journey?
Yeah.
I actually was. I was a CNA for a summer during college. It was my first exposure to I volunteered before that, but as far as first official job in the healthcare field was a CNA. And I tell you what, I did everything from bedpans and changing, getting, this was in a skilled nursing facility.
Mm-hmm.
So I would get a lot of elderly 80, 90-year-olds, patients up and moving. And it was really rewarding, really challenging. But it gave me such a respect and admiration for every member of the medical team. And the nurses are just they're champions, and they can be, they're just so critical to the care. And I have some awesome nurses that I work with now, and I just have a lot of appreciation for kind of where that was. So that was a truth.
All right.
And the lie was the flute play.
Oh, really?
It was kind of it was a partial lie, because I played the piano for 10 years.
Nice.
So Amanda, you got it. I did play an instrument.
Yeah.
And I don't have a piano in my place now. It doesn't really fit anywhere. But my goal is to someday be able to get back to playing the piano more regularly, because it was
great.
It's so there was a point where I actually found a piano during the pandemic, and I was like, oh my gosh, the mental escape that I'm having right now on the piano is similar to a run or similar to a bike ride. And so I'd love to get back to that.
Mental health.
Yes.
That's amazing. Well, where can our listeners find you, follow you? And we will link a bunch of stuff as well for our listeners, but go ahead and share with us where they can do all that.
Yeah. So a lot of the handouts and the videos are on our FASTR website, which is FASTR.Stanford at FASTR.Stanford.edu. Yeah, FASTR.Stanford.edu. And then we've got a social media Instagram at Stanford FASTR. I've got my Instagram, Emily Kraus MD, which is a combination of just my life experiences as well as what I'm doing in the work world. And I'm at Stanford. I'm seeing patients and still doing research. So it's a nice blend. So I can see you if you need to be seen, or you can just prevent some of those injuries by checking out some of our material.
Amazing. Well, thank you so much, Emily, for your time again today. This has been fantastic.
You're welcome. Thank you. It's been an honor. I'll also share some of those papers so you can distribute them
Correct.
if you want.
Awesome. We will link them. Thank you, Emily.
Right. Thank you.